The First Nations Regional Health Survey, or RHS for short, is part of a national population health survey on First Nations people by First Nations people. The RHS is for First Nations people living on reserve and in northern communities. The RHS was mandated by the Assembly of First Nations in 1996 because there was a gap in knowledge in First Nations health and wellness, especially for those living remotely and on reserve. The idea behind creating the RHS was to create a reliable, culturally relevant way to gather knowledge on First Nations people and make sure they benefit from the results. So how does the RHS differ from other national surveys? Like the census, the RHS happens around every 5 years, and its goal is to see trends in data over time. But unlike a census, people are randomly selected to take part in the survey, and participation is completely voluntary. Also, unlike a census, the RHS uses a holistic approach to track health and wellness trends specifically over time and have questions tailored to unique regions and peoples. It also follows the OCAP principles of ownership, control, access, and possession of the data throughout the entire research process. How does it work? The RHS-4 is mostly carried out by the FNHA, but we do need some help from communities. The RHS team at the FNHA reaches out to community leaders and asks if they are interested in having their community participate. Once we receive permission from community leadership, we work with the membership clerk to create a random sample of community members. What is a random sample? A certain number of people are chosen to participate in the child, youth, and adult surveys, since we cannot survey everyone. The number of people chosen is based on the size of the community. Names are then picked randomly, so everyone has an equal chance of being chosen. This continues until we have an even number of participants in each subgroup. Selected participants or their guardian are then contacted by our knowledge gatherers to obtain their consent to participate in the survey. Participants can choose to take the survey online, over the phone, or in person, if that is what the community requests. What is in the survey? The RHS asks questions about many different health-related topics, including health behaviors, health conditions, access to health care, and your environment. The RHS is divided into child, youth, and adult surveys, so the content in each survey will vary a bit. The survey takes around 45 to 90 minutes to complete, and participants can take breaks at any point. In return, the FNHA will provide a $25 gift card for your time. Something that really sets the RHS apart from other surveys is how the results are used. Once the data is collected, the FNHA and FNIGC analyzes the data and looks for trends. From this, we create national, provincial, and regional reports. Data is returned at the sub-regional and community levels when possible. Communities can use this information to apply for grants and inform their policies in their health and wellness plans. In line with OCAP, the data is owned by communities, but it is stewarded by the FNHA and FNIGC. To wrap up, the RHS is an important ongoing survey which takes a snapshot of the health and well-being of First Nations communities at a point in time. It is by First Nations, for First Nations, and its findings seek to improve First Nations health and wellness. By participating, you are contributing to this step forward in First Nations-led research and are helping contribute to the future of healthy, self-determining First Nations communities.